Hello, this is Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is what you need to know about Facet injections. Facet joints are the small thumbnail-sized joints on either side of the spine at every level from the neck down to the sacrum. These joints include cartilage just like the hip or the knee, and together there's over 40 of them. They combine to allow for an incredible range of motion of the spine. They are prone to arthritis though because they do contain cartilage. So even though they are small, they can cause a ton of pain. Here you see a facet joint with a lot of bony overgrowth. The red's supposed to simplify inflammation, okay? But there's not a really good joint space here. Typically, it leads to pain in the vicinity of the arthritic joint. Often patients have several arthritic joints at the same time, causing symptoms. Here you see a spine from the sort of an angle. You have a normal looking facet joint here, normal looking down here, but here you have that same thing with the redness, the inflammation. You have some overgrowth of bone here. Underneath, you're probably having significant degradation of the cartilage. For symptomatic facet arthritis, there really is not a great surgical answer. We don't have a facet joint replacement that works. It's a very complicated joint to reproduce motion, so we don't have like a hip replacement or a knee replacement type procedure that's very successful. We also don't want to fuse a spine that has multiple levels of facet arthritis because that will inhibit motion and cause problems down the road. So there are excellent non-operative options, and facet injections with steroid medication are one of them. It's an outpatient procedure. It only takes about 10 to 20 minutes. Modern pain doctors do use image guidance known as fluoroscopy or ultrasound. Typically, IV sedation is usually not required. The skin is numbed up and the soft tissues as well. The needle is placed into the joint and then dye is placed to make sure that accuracy of inside the joint. Once it's ensured, then steroid and numbing medicine is placed. A pain doctor can do several levels at one time, and the procedure can be repeated every few months. Well, how well does a facet injection work? 82% of patients receive pain relief over 50%. And significant functional improvement was seen in 78%. And that's with or without steroid. The numbing medicine itself has some excellent effects. The average duration of pain relief with a facet block is 15 weeks. So it's between 3 and 4 months. The same results have been seen in several studies. So it's real. The procedure is an excellent non-operative method of achieving neck or back pain relief due to spinal arthritis. If the pain comes back, there are three treatment options. One is to repeat the facet injection. Two is to have a medial branch block performed, which is an injection around the joint, not into it, of numbing medicine and maybe some steroid to block the transmission of pain signals through these medial branch nerve endings. Okay? And the third option is to move on to a radiofrequency ablation, which is where a catheter is placed around the joint and heated up to deaden the sensation from those little nerve endings. That can provide pain relief for up to 18 months. It's an amazing procedure. So the pain relief with the facet or medial branch block averages 3 months, and then radiofrequency ablation, as mentioned, is 6 to 18 months. There are very low risks with facet injections. There are slight risk of infection, bleeding, allergic reaction. The needle does not go into the epidural space, so there's a negligible risk of nerve root injury. The top non-operative pain management in Dallas, Fort Worth is through the TEX-PAIN Network. There are several clinics throughout the Metroplex, accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at painmanagementdallas.com and then call for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.